President Donald Trump signed the HALT Fentanyl Act into law. He classifies both fentanyl and fentanyl-related substances as Schedule I narcotics. The HALT Fentanyl Act imposes a mandatory 10-year minimum prison sentence on traffickers and distributors of fentanyl-related substances, as well as promotes research on Schedule I drugs. Fentanyl is a human-made opioid used to treat severe pain. It's 50 to 100 times stronger than morphine. The drug interacts with receptors in your brain to create feelings of pain relief, relaxation, contentment, and pleasure. While it's safe for your doctor to give you fentanyl in a medical setting, some people abuse it, which can lead to an overdose. Where does fentanyl come from? Fentanyl is in a class of drugs called opioids. Opioids come from the opium poppy plant. While some opioids come directly from the plant, fentanyl is made in a lab by scientists using the same chemical structure. People sell illegal fentanyl as a powder, dropped onto blotter paper, put in eyedroppers and nasal sprays, or as pills that look like other prescription opioids. Fentanyl can also be diverted. That's when the drug is prescribed by a doctor but isn't used as directed or is sold or given to someone else. A sharp increase in deaths from illegal fentanyl use started in 2005 and continued through 2007. Again in 2011, both deaths from illegal fentanyl use and police encounters with illegal fentanyl use rose significantly. This overdose rate has continued to rise in part because fentanyl is often mixed into or sold as other drugs. Because fentanyl is so strong, it takes only a small dose of the drug to cause death. What is fentanyl used for? Your doctor might prescribe fentanyl if you have severe pain due to cancer, nerve damage, serious injury, or major surgery. Before giving you fentanyl, your doctor should ensure that you're not allergic to it or to any other narcotic pain medications. Tell your doctor if you've ever had breached apnea, breathing problems, a brain tumor, a head injury, a stroke, seizures, liver or kidney disease, slow heartbeats or other heart problems, low blood pressure, mental illness such as depression or schizophrenia, hallucinations. Also tell your doctor if you've used an antidepressant called a MAO inhibitor, isocarbazazid, linezolid, methylene blue injection, phenelzine, rasagiline, selegiline, tranylcypromine in the last 14 days. You're pregnant, plan to become pregnant, or are breastfeeding. Lozenges, sometimes on a stick, Actique. Skin patches, Fentora. As an injection or through an IV, Sublimase. Tablets that dissolve under your tongue, Abstral. Mouth sprays, Subsys. Nasal sprays, Lazanda. The drug can be manufactured illegally. Dealers may sell it as a standalone drug or as a counterfeit for another drug, like oxycodone. It's also used as a low-cost additive to other drugs like heroin, methamphetamine, Molly, and ecstasy. When people take fentanyl illegally, they may take it by smoking or snorting it in powder form, injecting the liquid form, swallowing the powder in pressed pill or tablet form, putting drops on blotter paper and putting it on their tongue, spraying the liquid form into their nose, dropping the liquid form in their eyes, sucking on candies made with it. Fentanyl effects. Fentanyl acts like many other opioids such as morphine and heroin. It works by changing the way the brain and nervous system respond to pain. Short-term effects. The high that people feel from fentanyl causes effects such as relaxation, euphoria, pain relief, feeling of calm. Fentanyl side effects. After a fentanyl treatment, you may have side effects that hinder your thinking and reactions, or cause dizziness or drowsiness. Because of this, don't drive or do activities that require you to be fully alert and awake after your treatment. Avoid drinking alcohol for several hours after you take fentanyl. Fentanyl may cause other side effects. Let your doctor know if any of these symptoms don't go away or become serious. drowsiness, stomach pain or heartburn, weight loss, trouble peeing, vision changes, anxiety or depression, unusual thinking or dreams, trouble falling or staying asleep, dry mouth, sudden reddening of your face, neck, or upper chest, shaking in any part of your body, back or chest pain, mouth pain, sores, or irritation in the location where you were given fentanyl, swelling in your hands, feet, arms, ankles, or lower legs. After you've taken an opioid like fentanyl for a long time, your brain gets used to the drug. This means your tolerance goes up, and it takes more of it to get the same effect. You also have trouble feeling pleasure from anything besides the drug. Over time, using fentanyl may also cause unstable mood, reduced libido, constipation, problems with your menstrual cycle, breathing problems. How long does fentanyl stay in your system? This drug stays in your system for 24-72 hours. This means a drug test would detect it up to about 72 hours after you've taken it. Prescription fentanyl can work for various amounts of time depending on how you take it. Tablets, lozenges, and nasal sprays take about 15 to 30 minutes to work, but wear off after 4 to 6 hours. Fentanyl patches can take up to 2 days to start working, but they last longer. Interactions. Mixing fentanyl with any drug is risky, but some drugs pose a serious danger if you take them alongside fentanyl. You should never take fentanyl with amphetamines. You can strain your heart and go into respiratory arrest. Nitrous oxide. This can keep you from controlling your muscles well, sedate you, and lead to unconsciousness. Alcohol/benzodiazepines/ketamine. You're at a high risk of becoming unconscious and dying. You can also easily choke on vomit.